Transportation Group Supervisor. The Transportation Group Supervisor will provide and coordinate patient transport, fill out and maintain a patient tally sheet, including name and destination of patient, and direct departing ambulances to hospitals based on capabilities and triage category. The Transportation Group Supervisor will also provide periodic updates to the Medical Branch Director and the Primary Communications Center. The Transportation Group Supervisor is responsible for tracking the destination of each patient using the trauma triage tag and/or a general description of the patient. Oftentimes, patient identifiers such as name and date of birth aren't available at the scene of an MCI. The Transportation Group Supervisor will consult with the Treatment Group Supervisor and establish a loading zone. The loading zone should have separate entrance and exit routes to accommodate the flow of ambulances. The Transportation Group Supervisor will advise the Medical Branch Director of loading zone locations, air medical landing zones, and the best route for access. The Transportation Group Supervisor will maintain communications with the Medical Branch Director, receiving updates on hospital availability. In extreme cases, this can be facilitated by appointing a Medical Communications Coordinator. The Transportation Group Supervisor will request ambulances from staging as needed and also advise the Medical Branch Director when the last patient has been transported. The Polk County MCI plan provides specific instructions for the destination of patients based on triage category. Please refer to the full plan for the hospitals included and their definitions. As transportation begins, the Transportation Group Supervisor will notify the Medical Branch Director of the total number of patients each facility will be receiving by triage category. An attempt to split pediatric patients evenly between the hospitals should be made if possible. Red patients will be divided equally between the two trauma centers. Yellow patients will be divided equally among the metro hospitals, with the most severe or potentially unstable being transported to the closest facilities first. The least severe, or more stable, should be transported to facilities farther away. Depending on location, consider transporting some of these patients to area hospitals. The first yellow patients leaving the scene should be transported to hospitals other than the trauma centers that received red patients. This will give those facilities time to recover and prepare for yellow patients. Green patients will be divided equally among all metro hospitals, including both trauma centers. There is no set order for transport. However, consider transporting a greater number of green patients to the closest area facility, since most of these patients will be treated and released with minimal time in the ER. Green patients may be transported several at a time, provided adequate BLS staff are available for each transport. Minor or non-injured patients should be collected at an assembly point away from the incident and held there. EMS personnel can treat minor injuries and should remain with the group in case someone develops delayed symptoms. If that happens, new patients should quickly be separated from the group and moved to the appropriate treatment area. The Transportation Group Supervisor should request mass transportation from the incident commander for the removal of all uninjured patients as quickly as possible. Regardless of patient triage category, the transporting crew should avoid making direct contact with the receiving facility unless it's medically necessary or the patient condition worsens. This is intended to avoid unnecessarily tying up resources at the receiving hospitals.